join us for. If you all haven't met me before, I am Dr. Bridget Sellers, and I'm the founder and CEO of Dr. Sellars Educate, where our mission is simple. It's been the same for 5 years now, which I can't believe. We are celebrating our 5-year anniversary. We officially launched the company back in January of 2021. And it was really based on a conversation that me and other colleagues had across the country related to the challenges associated with going on this CNE journey. We like to call it a journey because that's exactly what it is. So, tonight, what you're going to walk away with are some tangible first steps to help you move forward on your CNE journey. If you've heard about me before, then you've probably heard the part where I talk about it took me almost 8 years. Yes, 8 years to get CNE off my bucket list. And there were three main reasons. Number one, I didn't know where to start. Number two, I had a fear of failure because who wants to fail? And then number three, I really didn't have a community to support me. So when there were times where I got stuck, which was often, or I felt overwhelmed with the content, I didn't have a community to support me. I would ask colleagues, I can remember it just like it was yesterday. When I was at Cal State Fullerton, when I was at Winston-Salem State, I would say, okay, let's get together and study for the CNE exam. And often colleagues would tell me, oh, no, that's a really hard exam, or I've tried it before. So I know many of you can relate to some of these experiences that I have had. And that's why we launched Dr. Sellars Educate back in 2021. I engaged in a really fun icebreaker today, so I thought I would try it with you all tonight. So the question is, what are you looking forward to in 2026? Happy New Year, everybody. I was just told by colleagues, I think it's last week during the monthly boot camp, that we're not supposed to say that after the 15th. So I have 2 more days to say it, I guess. So what are you looking forward to in 2026? Put that in the chat for me. What are you looking forward to in 2026 now that we are in a new year? And for those of us that do write goals, maybe we don't call them New Year's resolutions, maybe we call them goals. Oh, I love that, Renee. That's right. Passing the CNE. That's a wonderful goal to have. What else are you all looking forward to in 2026? Oh, Susan's going to have a new grandbaby, but also both the CNE and CC are in under my belt. That's awesome. Yes, I can remember being on that journey as well. Moving on from CNE novice to CNE. Yes, that's excellent. Beverly, it's good to see you. Yvonne says passing the CNE, attempting and passing. That's right, Joan. Following your plan, following your 7-week study plan, which is what we're going to talk about too, and passing the CNE. We also believe, and we're committed to, the only way you will not pass the CNE exam is if you quit. That's the only way because we believe in supporting you until you are successful, no matter how long that takes. And Darlene says passing the CNE as well. Excellent. And then let's see what else she said. Helping my niece who's entering nursing school. Wonderful. Yes, I have a cousin in nursing school, and then I have 3 other mentors or mentees that I'm mentoring on their journey. And it's been quite the journey for one of them because she didn't do as well as she thought in her patho class. And so she's had to pivot, we like to call it, and take a different path. But that's okay. She's going to get to exactly where she needs to be because she's going to make an excellent nurse one day. All right, so if you haven't already, we want you to take out your notebook because you will be taking notes. I also learned about a new strategy, which I've heard about, but I actually saw it happen this week when I was attending a workshop as our commitment to many of us have a long-term commitment in nursing education. And part of that commitment requires us to be lifelong learners. That's exactly what Malcolm Knowles talks about. And our ability to be lifelong learners requires us to sit in the seat as a student from time to time. So I was a student, actually, it was last week during a workshop, and they actually use the sandwich principle, some call it, but where you're engaged in content review for 25 minutes and then you have an activity, a stretch break for 5 minutes. So you all are the first group that we're actually going to do that with. That's really hard. We weren't able to do it with our CNE in 60 days group yesterday because we just got so deep into content. So we didn't have a chance to do that. But that's what we're going to do with you all. At the 25-minute mark, you all keep me honest. We're going to take a stretch break, just a 5-minute stretch break, and then we'll come back. Everybody will come back and we'll finish our conversation for tonight. So, what we're talking about tonight is what exactly needs to be part of your blueprint for success. In education, we talk about how important it is to map our exams to the blueprint. So, why is that? Why do you think a blueprint is so important? What does that blueprint provide for us? Put it in the chat. What is it that the blueprint provides for us as educators? What's the value of that exam blueprint? And then for our students, why do we have a blueprint? Put it in the chat and let's see what you all think. Why do we have that blueprint? Why is it important? What's the difference that it can make? Why do we have the blueprint? As you all are typing, Darlene says a guide to what we are to know and study. Absolutely. Susan says help direct the study to the desired outcome, minimize time wasting. I love that air quote. We're going to talk about that tonight too, because time is our most valuable asset. And once it's gone, we can never get it back. So that's what we're talking about. How do you maximize the time as you're moving forward on your CNE journey? So you're not wasting your time. Yvonne says standards, absolutely. Joan says precision and guide studying. That's right. We want to be able to guide our students to focus on specific concepts that they need to study and have that deep comprehension about so that ultimately they can pass NCLEX and make safe patient care decisions. And that's a similar journey that you all are on. 70 to 80% of these questions on the CNE exam are at that application and analysis level, just like is described by Bloom's taxonomy in Billings and Halstead textbook. So I'm going to go ahead and put in a plug right here. Billings and Halstead is going to be your primary textbook on your CNE journey. Now, this is the 6th edition. The reason why we use the 6th edition as our primary textbook is because we know the exam writers used this one when they were writing the actual exam back in 2023. Now, the 7th edition is available and it's a beautiful edition. It has excellent content. If you already have the 7th edition, there's no need for you to go by the 6th edition. We've already mapped our study plan and the content, the resources that we provide for you all. We've already done that, so you don't have to worry about going to buy 6th edition if you happen to have the 7th edition. I think I have now, I'm missing one edition, I think the 1st edition, but I have all the other Billings and Halstead teaching and nursing textbooks because when I was in the nursing education program, that was the primary textbook, and I teach at the graduate level, mostly nurse educators, but some nurse practitioners as well. And that's been a textbook we've used forever. Now, the other resource that is recommended, we still use it, but it's Dr. Caputi's CNE review book. Now, this is the 2nd edition. Okay, don't get the 1st edition because it doesn't have enough content about learning theory, about online learning, about simulation, because in the 1st edition, there wasn't a lot of those type of teaching strategies and access actually talked about. Okay, so those are the only, I want to say this again, those are the only textbooks that you need. And I know there's a lot of noise, there's a lot of conversation around a variety of textbooks. And this is what we know. Those other textbooks actually cite Billings and Halstead because those are our pioneers. I had a chance to meet them at the NLN conference 2 years ago, I believe it was, yes, or maybe 3 years ago now. And both of them are delightful, still have a heart and a passion for nursing education. And of course, they were delighted to hear that we recommend their book as well as Elsevier. We love Elsevier and all of the great work that they do to bring us the textbooks that we need, not only for us as good educators, but also we know they publish textbooks for our students as well. All right, so what I want you to next do on your sheet of paper, so now you've already written down the 2 main resources you will need, the textbook, Billings and Halstead, Teaching and Nursing. 6th edition is a must-have. Not only is it going to help you on your journey to CNE, it's going to help you become a better nurse educator. And then you're now going to write down what is the number one barrier that's gotten in the way. Maybe it's already crept into 2026 as a carryover from 2025. What is that number one barrier that's getting in the way of you marking CNE off of your bucket list? Okay, because I want you to have a very transparent conversation with yourself about that as we kind of talk through some key points for tonight. The next step we're going to take is to go to the NLN website. We're going to go, as you all can see, we are dropping pearls of wisdom really early because I, again, want to maximize the time that we have together. So when you go to the NLN.org website, you're going to go directly to the CNE exam section. Okay. And you're going to get there by going to NLN credentialing. And then you're going to choose CNE under NLN Certification Division. They've moved the location of this a couple of times. So I want to make sure you all know exactly where to go. And then the next step you're going to take is to go ahead and print your handbook. This is the third must, well, technically the second must have because Caputi is optional. And the reason why we recommend Caputi, even though we realize it is no longer on the recommended references list in the handbook, and our land commissioners won't tell us why it was removed. We think it's because her book is now dated. I think it was last published in 2021. And because it's the second edition, we don't know if Dr. Caputi's gonna, it's 2020 that it was published. We don't know if she's gonna update it, but maybe that's why. We don't know. But we do know that exam writers actually used these two books as their primary resources when they wrote the exam questions, as well as Dr. Orman's work related to exam analysis. And what we've done, we incorporate many of the concepts that are in her textbook into our curriculum so you don't have to spend additional money that's not necessary. All right, so why are you printing out this handbook? Because that's exactly what we want you to do. We want you to print it out, all 32 pages, because not only is this a free resource, but it is your guide. It is going to help you identify your knowledge gaps. Now, one other point we want to make sure you're aware of, there could be questions, and you should expect questions on the CNE exam related to content in the handbook. Okay, did I mention this is a free resource? But yet we find that about 40% of nurse educators didn't realize that this handbook existed and that the blueprint is in the handbook. NLN is not trying to trick us. They really want us to be successful. The number one reason, and this is what the commissioners told us many years ago, colleagues are not successful in passing the CNE because we know for years it's been times where it was even below 72%. And now I think the last number is around 76% or so. But the number one reason, Commissioner said, is because of lack of preparation. Well, at Dr. Sellars Educate, we say that it's lack of proper preparation. And yes, we'll go ahead and put it out there right now. We've heard nurse educators that can access a CNE prep app and you can take 20 questions for free every week or something like that. And this is our recommendation based on what the commissioners have told us as well when we've met with them throughout the years. Those resources, that app is not developed or endorsed by NLN. And so what you're doing is you're gambling a little bit because those specific questions may or may not help you clarify your muddy points. That's the real reason why any of us, whether it's a student that is in a pre-licensure program or a nurse practitioner student getting ready to take her exam, her credentialing exam, his or her credentialing exam, or us that are on the journey for CNE or CCRN, like another colleague here. The reason why we take practice questions ideally is to help us identify where our knowledge gaps are, where our muddy points are. However, let me tell you something that's different with the CNE. There is no relationship between taking practice questions and passing the CNE exam. And the number one reason why, contributing factor, is those questions are not written by the exam writers for the actual CNE exam. So this is why, yes, those questions may seem like they are helpful, but you don't know that for sure, and you're at risk of wasting time. Now, the only practice questions that NLN endorses, of course, is their self-assessment exam, okay? And you can find information about that on their website. Now let's talk about this blueprint a little bit. So there's two components related to the blueprint. And this is a gift that NLN gave us back in 2023 when they revised the blueprint. So remember, I said we started our company officially in 2021. So we knew based on feedback and updates we heard at the summit. How many of you all have been to the NLN Summit before? Put in the chat for me. One, if you've been to the NLN Summit ever, and two, if you've never been. So put in the chat for me just so I can see who's in the room. One, if you've been to the summit. Two, if you've never been. Okay, 2022. Oh, never. Well, I highly recommend it. It is an excellent summit. You definitely want to take advantage of the early bird rate if at all possible. It is an excellent summit because they provide updates of, and not only do we have colleagues that are sharing evidence-based practices, but they also, the NLN commissioners and team, they provide updates regarding the CNE exam. So it's a great time to get updates from an academic, scholarly work type of expectation and partnership, but also just those general updates regarding CNE, especially as you all will be on the journey for renewal, which is a 5-year window. So once you get your credential as a CNE, you will have 5 years to renew it. Okay. And that's a whole nother conversation. Our recommendation, okay, is to go ahead and set up your certification portal on day one. Okay. So you can write that down for future knowledge. All right. So let's get back to the blueprint. So what you're going to do and how you're going to use this blueprint after you've printed out is twofold. First, I just want you to take a look at the specific competencies. They just changed the nomenclature from category to competency. It doesn't mean anything that's different. Okay, so facilitate learning is competency one. You can see there are 47 questions that are aligned with competency one. You'll also see there's 18 questions aligned with competency two. 47 plus 18 is what number? Who can put in the chat for me? The mathematicians in the room or those that can use their resources quickly. 47 plus 18, put in the chat for me what that is equal to. That's right, 65. So 50%, 50, of the scored questions on the CNE exam is aligned with number one, our ability to be a really good teacher, which is competency one. And then, second of all, our ability to connect with our students, our ability to truly support them on this learning journey. That's competency two. Those specific competencies are the foundation that we have to build on as it relates to achieving excellence in the classroom, in the SIM and skills lab, and in the clinical setting. So 65 questions, and remember I said that's 50% of the actual scored questions. Now, there are 150 questions on the exam, just like you can see here. However, 20 of those are unscored, being pre-tested for future use. We don't know which ones those are, so we want to make sure that you are making decisions for every single question as if it is scored, okay? So part of our curriculum is designed to spend about 60% of our content review to align with competency one and two because there's such, both of those areas have such a heavy content, and rightfully so, as it relates to the CNE exam. All right, so that's the first part, is it just gives you a really good overview of how many items you can expect to see that's tied to the specific competency. The second really important consideration regarding the detailed test blueprint, look at this wonderful gift that NLN has given us. You are going to use this as a self-assessment tool. So what do I mean by that? You're going through and you're asking yourself one question, okay, about all 63 of these sub-competency statements. Okay, so there's 63 statements that are embedded underneath the total of 8 competencies. And this is what we want you to ask yourself for every single one. How likely am I to be able to choose the correct answer on the CNE exam when I see a question related to this concept? Okay, so let me give you an example. It's a top 3 gap area for about 60% of the nurse educators that we support on the journey. So it is competency 1B, learning theory or educational theory. So you would do a self-assessment. You want to be very transparent with yourself, asking yourself, how likely am I to be able to choose the correct option on the exam when I get to a question about using teaching and learning strategies based on learning theory, educational theory, or evidence-based practices related to education. If you're not at least 70% confident that you will be able to choose the correct answer, we want you to circle it, highlight it, put an asterisk. Even if, 80% of the blueprint areas are going to be highlighted, that's okay because this is a pre-assessment, right? And then we highly encourage you to do a post-assessment at the end of your 7-week study plan, your 7-week study journey. So Grace asked, do we need to answer all of the questions, or is it like the in-class ones? We meet a passing score, the system stops the test. Excellent question. Nope, everybody takes 150 questions. Good question, though. And we did ask the commissioners, is it weight-based? So does each question count equally? They would not answer that question for us. They also will not share what the passing score is. Generally speaking, 70% tends to be the threshold out of the 150, but again, every exam, there's some variation. Usually, there are two versions of the exam, but obviously, the questions could vary based on the version. Again, commissioners will not tell us that much information. We've asked a couple of times. We'll keep asking as we develop close relationships with the commissioners. But yeah, so that's what you want to go through and do. That's how you want to use this tool. And then maybe you're in that gray area. You're not sure if you're at that 70% mark. We want you to err on the side of caution. That means you're going to highlight it if you have any doubt about it being about your confidence not being at that 70% level. And this is a pre-assessment. We know that as you move forward on your journey, you're going to build not only competence related to this area, also you're going to build confidence. But there's value in knowing, going back to the blueprint, you all already hit the nail on the head. There's a value to knowing exactly what your roadmap should look like related to concepts that you should focus on. We do not recommend, again, I want to say it, we do not recommend that you read all 600 pages or so of Billings and Halstead. Now, some colleagues, we just found this out in our monthly boot camp last month, did choose to read every page. That is not going to maximize your time. We want you to be laser focused on specific concepts tied to this blueprint that are going to help you achieve success. And that's part of the journey that we go on with you. We specifically identify page numbers and chapters so you know exactly where you should focus as you're moving forward on your journey. All right, so now let's talk a little bit about content. So what does this mean? Let's see where we are with time. Okay, we're almost at time. Oh, it's already 25. Okay, give me 2 more minutes since we did start a little bit later. So this is about empowerment, helping you all know exactly what your next steps are going to be. That's what you're going to be able to achieve at the end of our time together. If you have a colleague that you know needs to be in the room, let them know that we have 2 more Tuesdays and you want them to come on this journey with you because it's far more fun with a colleague, right, as you're moving forward. Even if you all decide to use our resources, if you all decide to join our CNE in 60 Days program, great. If not, you're still going to have tools at least to get you started. That's our goal. We want this to be meaningful time that you're spending with us. We respect that. So you get to choose. You get to choose if you want to go forward on your journey alone or if you want us to support you. But we just want to talk to each of you about what you can do to get started since, as I mentioned, that got me stuck for many years. So who is this workshop for? Well, let's talk about the administrators in the room. So maybe you are struggling to stretch faculty development dollars. We know that many colleges have had to trim or sometimes even cut their budget. I know that I am constantly advocating for those faculty development dollars, and it doesn't help when these conferences become more and more expensive. Seems like every single semester, every single year. This is what Lindell, Hagler, and Poindexter pointed out in their research in 2020. Research shows that some CNE certified educators reported improved teaching outcomes. We all want that. And higher student success rates, increase in persistence, and increase in retention, making certification a smart investment for your program. That's what we have to think about as administrators. How can I justify that this is truly an investment in my nursing faculty. Our nurses as educators, because all of us are educators, but for specifically for those of us that are formal educators, we have to have a passion and purpose daily daily in order for us to do a really good job. We know that the impact that we have is at a very high level and that it lasts a really long time. I'm sure that many of us can reflect on what our nursing faculty, how they made us feel. I was reflecting last week on the first time I went into a patient's room. I can remember I didn't have a whole lot of confidence as a new nursing student. Most of us don't. However, I knew I could depend on my nursing faculty to help me. With Duke Nursing and their initiative, Duke University School of Nursing, they had an initiative called Certified by July. Now, put in the chat for me one, if you've heard of Duke University, two, if you've never heard of them. Put in the chat for me one, if you've heard, because I don't want to make any assumptions. One, if you've heard of Duke University. Two, if you've never heard of them. Okay, so I'm seeing a lot of ones. Excellent. So you may wonder if you're like me, because we certainly did. Now, Duke has been voted by U.S. News and World Report many years as being the number one nursing program in the country. So when they reached out, we thought, you want to partner with us? Okay, we're excited. And so that's what we've done together. This will be our third year in partnership with Duke University. Consistently, they have had 100% success rate for colleagues that follow the 7 week study plan. And they were actually awarded the NLN Certification Star Award because they had such a strategic partnership and a goal every year to increase certifications by July. So just think about as an administrator, as a nurse educator leader that's in the room, how can you truly leverage the outcomes that we're talking about the evidence, specifically with the previous research findings, and now with a very well known nursing program? How can we truly leverage the outcomes that we're talking about to justify that this is an investment that we're making in our faculty, with our faculty, to help them be a better nurse educator? Or maybe that's some of you all that you're thinking about, okay, how can I justify this with leadership to pay for it? We want to provide that information for you. All right, so it's time for us to take our 5 minute stretch break. So everybody stay logged in, but I want to honor this pilot that we're doing. So take a stretch break and we'll be back in 5 minutes. Okay, I'll see you in a little bit. And feel free to put questions in the chat because I want to make sure I cover any questions that you have. So go ahead and put your questions in the chat because I want to make sure I cover those before we end our time together tonight. So put your questions in the chat. And let's see. I'll stop sharing and put on some music for our last few minutes of our break. Okay, so it is called the Pomodoro technique. It is a proven method for better focus, preventing burnout, and improving memory by using short, timed work study intervals. So this is effective for work as well, followed by short breaks of 5 minutes with longer breaks after 4 cycles. This approach leverages your brain's natural ability to absorb information in focus bursts, making long lectures less overwhelming and more productive by integrating rest for mental recovery and better retention. So there's actually research related to this technique. I've heard it called sandwich technique before, so it's something you may want to try out. It is hard though, I have to admit, because you just want to keep talking, especially when you have, a period of time that is dictated by the schedule, and we know students don't want to stay a minute longer than they have to. But it's worth something trying. Try it and see what you think. All right, so now we're going to wrap up, and because I want to be respectful of everybody's time. And picking up where we ended, which is around transformation over transaction. So, yes, there's a transaction that happens. You're trading your time, your free time, to focus on concepts. And ultimately, as you're moving forward on the journey, you want it to be a transformation. You want to identify these evidence-based teaching strategies that are not only going to help you pass the CNE exam, but also it's going to help you become a better nurse educator. You are going to be more likely, and that's what our success framework has shown us. We've surveyed hundreds of nurse educators, probably thousands now, that some of them have been in our program, some of them have not. And what we consistently hear is that when they treated this journey, not as if they were teaching or not as if they were studying to pass a test, but they were really reviewing content and concepts to help them be a better nurse educator. Our learning objectives for our time together is truly about you unlocking the power that you have to achieve success. So, objective number one, and you all notice we didn't start with objectives because there's no rule that says when we start our learning experiences, we have to start with objectives. So, why not start the learning journey right away? Why not jump right in, telling students what they can expect, telling our learners what to expect, and what we expect of them? So, what you all can expect after spending our time together here is you'll be able to list 3 essential resources. And look, you're already able to do that. And next steps to successfully pass the NLN CNE exam. And hopefully, you've already identified number one, your number one barrier. Number two, hopefully, you're starting to think about okay, how can I mitigate? How can I push past that barrier to help me cross the finish line? What strategies can I use? Which is next. Identify at least 3 strategies from certified nurse educators for passing the exam the first time. We've talked about a couple. We'll continue to talk about more as we continue our conversation tonight. And then the third objective is describe. You will be able to describe 3 key behaviors that align with the NLN nurse educator competencies. So that's our goal, is not only to help you do that self-assessment using that blueprint, also to think about what specific behaviors, what specific evidence-based teaching strategies are going to help you become a better nurse educator and align with the 8 competencies that we just took a look at. All right, so maybe this is you. Okay, so we talked about the first group that may be in the room, and that's administrators. The second group that may be in the room are those educators that are on the fence. Maybe you're not sure if CNE certification is a right fit. Perhaps you've heard some of the same challenges that I heard when I was on my journey, that number one, the failure rate is high. Number two, it costs too much money. And number three, the reality is you're not sure if there's a true return on your investment. Maybe some of you, this is part of your tenure or promotion journey. Others, maybe not. Maybe you're just here trying to figure it out. And this is what Barbet and Kimball found in 2018 and published. Their study indicated that CNE certified educators reported increased job satisfaction, higher confidence, and more opportunities for career advancement. So today, we want you to decide if this is your next step. When you think about the investment that you're making, it is time. In fact, Based on the 7 week study plan that's part of our success framework that we have published, we know that you are committing to, okay, I'm trying to be careful with my words because I want it to be positive. You are committing to at least 120 to 140 hours of your time. When I talked about the Duke Initiative, certified by July, achieving 100% pass rate when following the 7 week study plan, we still see a 98 to 100% success rate for all of the colleagues we support on the journey when they follow that 7 week study plan. It's no different than what we tell our pre-licensure students. I know I have a group right now. We don't want them waiting 3 months to take the NCLEX right after they graduate. We know there is value in the recency effect, the research tells us. And so we want to make sure that we are investing the amount of time that we need to in order to achieve success. And then money, because there is money, and going back to the exchange, the transaction, there's money that you're paying for the exam, for preparation materials, because the goal is that you will be one and done, that you will only take the CNE exam one time. Because I don't know about you all, some colleagues ask us this from time to time. We haven't had this question in a long time. We know that there's two ways to renew your CNE after that 5 year window. You can choose to take the exam, or you map out a plan so you are earning renewal credits, which again, we talk about that later. Once you get certified, we have a monthly boot camp. We actually offer that workshop on CNE renewal process because we are accredited as a provider by ANCC. All of our courses, all of our curriculum content is mapped to the guidelines, evidence-based guidelines that are required for you to be ANCC accredited. So part of the renewal process is you have to have right now is 75 renewal credits over that course of 5 years, or you have the option of retaking the CNE exam. So we get that question, should I retake the CNE exam? That is not our recommendation. It is a challenging exam. However, you can do it. Okay. It's just going to take that time commitment. And when we talk about the investment, it is absolutely an investment, and it is one that pays off. Now, this research by Poindexter, Lindell, and Hagler in 2019 showed that those colleagues that did achieve certification, it absolutely boosted their professional recognition because there is some credibility associated with us that have our CNE. With career mobility, it actually offers a higher return on investment based on the time and money that you are committing. Because remember, it's one time, right? It's a one and done. All right, so maybe you're not administrator, maybe you're not on the fence, maybe you've had a lot of start and stop cycles. I know I did. You have the best intentions, it's a new year, it's been on your bucket list forever, and so now you're ready to get it off. Well, we're going to talk about what are some strategies to prevent that start stop cycle. Well, first, we know based on our success framework that having a structured, guided approach significantly increases the likelihood of success. So, what are we talking about structure? Well, specifically, it is having a 7 week study plan where we map out every single week you're focusing on a different competency. You're specifically looking at Billings and Halstead and Caputi, because Caputi is the Cliff Notes version. Now, I've said that term before, and I've had kind of a deer in headlights look at me when I've been in the room with other colleagues. So tell me in the chat, how many know what Cliff Notes versions, what that means? Cliff Notes version. Put a 1 if you know exactly what that means. Put a 2 if you don't. That way, again, I know who's in the room. So put a 1 if you know what Cliff Notes are. Put a 2 if you do not. All right, so all the colleagues here tonight. Oh, Joan is 1. Okay. Yes, Renee, we are dating ourselves. Well, the Cliff Notes version, I like to say, was the old way of using AI to give us a summary, right? Now we have AI that can just summarize for us. But back in the day, Joan, we didn't have that. So we have Cliff Notes. I can vividly remember World Civilization was not a course that I enjoyed at all. So I definitely had Cliff Notes that I would use. I would go to the bookstore, and back then they were like $1. It was super cheap, maybe $2. You could go and get exactly that. A summary of that specific topic related to world civilization. Well, that's what Caputi has given us. Each chapter in her CNE study workbook or CNE review book actually correlates with the competencies until you get to competency 5 and 6. Okay, because remember, Caputi's book was published in 2020. The curriculum, the blueprint for the CNE exam was updated in 2023. In 2023, they flipped competency 5 and 6. So that's why Caputi doesn't exactly align, but still the content is perfect and will definitely help you and has helped many colleagues achieve success. Another point about Caputi that I want to put a plug in about, by the way, I get no kickbacks, no endorsement. Elsevier is just a really nice partner. I've had partners with Elsevier, different vendors around the country for years. So we don't get any kickbacks from them. We just know based on the evidence, the data we've collected, that consistently colleagues are more likely to be successful when they only use these two textbooks. So the other point I was going to share about Caputi is colleagues have felt like that cognitive overload is decreased when they're able to sit and just read one chapter of Caputi every week or every night because it is so concise and gives you an excellent summary. It doesn't go deep enough, though. That's why we don't recommend Caputi as your primary textbook. It does the surface learning. It's a good overview, just like Cliff Notes, but it doesn't go deep enough. So one example is with learning theory. So if anybody in the room has Caputi's review book, let's just turn to Appendix A. That is learning theory. Okay, so what you will see in Appendix A, starting on page 161 in Caputi's book, is it gives you an example of behaviorism. So there's 5 main learning theories that you're going to focus on. And this is one of the strategies that educators have used to help them achieve success on the first attempt with the CNE is they have studied learning theory. And there are 3 elements you want to remember about learning theory. Number 1 is being clear about the underpinnings or the descriptions associated with that learning theory. Okay. Number 2 is you want to think about which theorists are most closely aligned with that type of learning theory. Okay. And then number 3, what are the specific teaching strategies that align with that learning theory? Okay. So I'm going to give you an example. So when we look at behaviorism, the principles, the underpinnings, the description of behaviorism is that learning is the result of changes in behavior. Learning is reinforced by response. Theorists include Watson, Skinner, and Thorndike. Jean Watson, what is her work known for? What is the type of behaviorism characteristics associated with Jean Watson? What's her theory? Who wants to put in the chat, what is Jean Watson's theory? I'm sure somebody in the room is familiar with Jean. Caring, that's right, Renee. Jean Watson's theory is all about caring. And her work says that we demonstrate caring. Yes, we may have it in our heart, we may have it in our mind. However, it's truly not applied until we demonstrate it with the behavior. So, what could that look like? It could look like us sitting down when we're talking to a patient. Remember when that was a big focus for patient satisfaction? I do. That was about 15 years ago. And there are many other Caritas factors. In fact, there's 10 different categories that Jean Watson talks about in her work. She's a delight as well, and her work is still very evident, not only in the clinical setting, but also in academia. Some universities have adopted Jean Watson's caring framework as part of their curriculum. And then the last column is application to learning. So some examples of teaching methods includes learning contracts. So that could be our clinical learning agreement or clinical learning contract. That's also our syllabus where students know exactly what we expect of them and they also know what that they can expect of us, right? So it goes 2 ways. And that's what you want to focus on. However, when you look at Caputi, and if you have Billings and Halstead, you would turn to table 14.1. So again, Caputi's giving you a great overview. For those of you that don't have it, don't stress out about it. Just know that it's simple bullet points that is given in Appendix A of Caputi. And then if you had the Billings and Halstead textbook, the 6th edition, you would turn to table 14.1. and that's on page 249. And you would see under behaviorism, that's going to start on the last page, which experiential learning theory is part of it. And also there's some information related to constructivism. Those two specific learning theories are aligned with the behaviorism learning theory. But when you look at table 14.1, you're going to see a whole lot more explanation. Yes, the category is still behaviorism, but constructivist, as an example, talks about the ability for students to put the puzzle pieces together. Well, we know that plays out using psychomotor skills. Students have to actually make patient care decisions, right? That's the behavior that we're looking for to validate that they are indeed competent. Okay, so let me give you an example. When it comes to skills checkoff, we talk about still technique in the didactic setting. When students get to the skills lab, we want them to insert a Foley as an example. Well, students' ability to follow those exact steps, they engage in behaviorism. They also engage in constructivism because they have to follow the 7 steps or whatever those are in sequence in order to not contaminate the sterile field. Okay, so that's an example of, yes, Caputi gives you a great summary, but it doesn't go deep enough, right? You got to have that deep comprehension of concept in order to recognize the correct option when you get to the CNE exam. All right, and then I left this screen up so you could take a screenshot if you needed to again, look at the evidence. That's another point that we value here at Dr. Sellars Educate. We don't want you taking our word for it, right? We know that there are a lot of different programs, and we want you to know that we only use and only recommend using textbooks. When we think about David Cobb's experiential learning theory, I will go ahead and put the plug in. If you haven't recognized it, I love theory. I always have because it helps me. It's always helped me, even as a new grad 30 years ago. It helps me make better patient care decisions when I understand the why, because I know the what, but I understand the why. I'm able to connect the dots, just like constructivist theory talks about. So that's what you want to think about as you're moving forward on your journey. Number one, what is that barrier, right? And then number two, what strategies are you going to use to help you get through those barriers? And most of all, how are you going to focus? Now that you've identified your barrier, hopefully you've identified some strategies to help get you through that challenge or that competing priority that's coming up. The next step is to think about how you're going to focus. Nurse educators report not having ability to focus on competencies consistently is one of the big barriers to success. The second part related to focus is the time to commit to studying. It can be challenging and it's hard to stay on track. So, what resources do you need to help you stay focused? We talked about 2 main ones, right? With Billings and Halstead, Teaching and Nursing 6th edition. Again, it's okay if you have the 7th edition. You just don't want any older edition than the 6th. 6th is primary, 5th edition doesn't have enough content around simulation. Where can you buy the resources? Well, that's the great thing about CNE in 60 days. If you choose to go on the journey with us, again, it's your choice. You can buy Billings and Halstead on Amazon. Okay, the 6th edition. You can't get it from Elsevier because they no longer print the 6th edition. And then what do I need to study in the resources? That's a great question. You want to stay focused, right? Focused on those specific concepts in Billings and Halstead because we do not want you reading 500 pages. Okay. Only 70%, that was back in 2024. Only 70% of nurse educator colleagues passed the CNE exam. That was for CNE, and then 74% for CNE clinical, 84% for CNE novice. And the reason why is because it can be confusing, it becomes overwhelming because it is a lot of content to study. However, you don't have to struggle alone. Just know that we're here to support you. We have a 7-week study plan that we encourage colleagues to follow. Well, that's exactly what Dr. Schultz followed as she continued on her journey, just like you all are today. She started with just a simple conversation in a room with us and committed to, you know what, I'm going to do this and I'm going to stay focused. She says, I passed my CNE exam. I felt very prepared and calm, which is a really important part that we haven't talked about, going into the exam. I didn't feel like there were any surprises. Many thanks for designing such a great preparation course for this exam. So, two really important parts that she identified. She felt prepared and calm. Your ability to achieve success on the CNE exam is what we like to say 80% competent, right? So you have to be at least 80% competent related to those eight competencies. So we're not just talking about book knowledge, right? When you look at the cognitive learning domain, we know that lowest level for Bloom's is remembering or memorizing, right? You have to go deeper. Going back to that blueprint, you're going to see 70 to 80% of those questions are at that application or analysis level. So your ability to achieve success is 80% competence, and then it's 20% confidence or your mindset. The feeling that you have about being prepared, that you have done your part, you have invested your time, you've gone through this transformation that we've talked about. So you're going to feel more confident going into the exam, knowing that you have properly prepared. We've talked about the success framework. Just to recap some of the key elements and findings from our work. Number one, experience is the best teacher. This is why we went in depth, giving you some examples, talking about how you can align the decisions you're making about your teaching strategies with the evidence, such as with Gene Watson's caring theory, what that really looks like. So, with our work that we've done, we know that experience is that foundation. You're able to draw from your experience when you get to the CNE exam. Now, you got to make sure it aligns with what the evidence is, but colleagues are more likely to be successful when they have at least 3 years of experience. Now, this is for the CNE, and NLN actually came out with the CNE novice. Actually, after we had already collected our initial research. So if you have less than 3 years of experience, we would recommend that you look at the CNE novice because that's exactly who NLN designed CNE novice for, colleagues with less than 3 years of experience. And if you still feel like after you go through doing your self-assessment, going through the blueprint, if you still have that mid-level, is what I would say, level of confidence that you may have less than 3 years, but you do feel like you want to focus on CNE, you can still be successful. It just means you're going to have to spend more time reviewing the content because you're not going to have those 3 years of experience to draw from. Okay, so that's the difference. Renee says, do you sell a hard copy of the Dr. Sellars study workbook? Yes, it is on our website. And if you don't see it, just email us. Sometimes, depending on updates by the webmaster, it may not be as visible. But yes, if you want just the study workbook, that's fine. Just email us. So that's the experience part. And then resources. So, as she just mentioned, we do have a study workbook that has the 7-week study plan. And then Billings and Halstead and the review book, those are the only resources you need. And that is Dr. Caputi's review book. And then support. Your ability to achieve success is deeply connected to community and consistent support. Now, that consistent support is what I couldn't find with colleagues at Cal State Fullerton or Winston-Salem State. And so I had to look for colleagues in the actual masterclass that I attended in person. So that was my group. That was my tribe that kind of helped me move forward, and we held each other accountable. But there are many ways that you can receive support. And again, that was part of our mission. That is part of our mission since we started 5 years ago. So for those of you that don't know, we have a YouTube channel, okay? And it's Dr. Sellars Educate. We launch a new snapshot every single week. Usually it's about 15 minutes. Sometimes we get a little long-winded with the content, so sometimes it's 25 minutes. This is the value, though, because we know that there are at least 2 colleges that have embedded our YouTube snapshots into their onboarding with their faculty. And so one of the faculty actually asked us this question at NLN. They said, did you know that your modules are part of part of our onboarding? They have about 500 faculty. And they said, well, did they get permission? Are they paying you for that? I was like, no, that's our free content. That's our gift to educators because we believe that we, as nurse educators, we are professionals and we are going to be able to change generations to come by improving our competencies. So hopefully each of us are gonna keep our CNE credential to validate to the public, to each other, that we have achieved the highest mark of professionalism, which is attaining your CNE. And then we also have a self-paced course. So some colleagues, they decide that I just want to do it on my own. That's what most of the Duke colleagues decided to do. So that's great too, because we all learn differently. For me, I had to have similar setup to this. I'm less likely to go into a self-paced course. I think I have purchased probably 6 self-paced courses of some type, and I still have them on a list that I go back to. But you have to think about, how do I learn best? Because that is the focus for you. That's what we want you to lean into, is to use the resource that is going to most consistently support you to achieve success. All right, so that's going to be the end of our content tonight. I am going to go ahead and put in the chat. I think for the colleague that asked for the study workbook, I think I can go ahead and put that in the chat. But if some of you feel like you're ready to move forward on the journey with us and you want our support, I will put information in the chat related to the CNE in 60 days. And you can see that we have one that starts in January, and we are in session 5 of next week will be session 5 for our December cohort. So it starts in January. You should be able to see that link. You are welcome. Thank you so much for joining us. Let's see, Susan and Renee. And yes, it was good to see you again, Demaron, for sure. You are welcome. Oh, thank you. Well, I'm glad that you appreciate it. Yes, I will put the study workbook in the chat, and I'm going to go ahead and stop the recording. And I'm happy to stay on and answer any questions that you all